Hello and welcome to In the Running. I'm your host, May Dapkus.
And I'm Olivia Self, and today we're here with Dr. Will Boyd, who is running for governor of Alabama. It's so nice to be with you.
It's an honor to be with you too as well.
Thank you for coming.
I'm excited. Thank you.
Okay, so our first question that we always ask is, we want to know about you outside of your campaign. So what are your hobbies? Do you have any family? Tell us about yourself.
Sure. I enjoy helping people. I know that doesn't sound like a hobby, so that's what I do most of the time. I'm a father to 3 children. My wife and I were married in June 20th, 1998, so we're almost at 28 years of marriage.
Wow.
We have 2 kids that are in college. One is a senior at one of the universities. Another is in her second year starting nursing school. And we have one who is in a middle school in a local area. So that's where we are. That's what I do. I serve in a number of capacities. I wear many hats, but right now I'm seeking to serve as governor of Alabama.
Amazing.
So what motivated you to pursue a career in public service?
I was actually a professor serving at a university now, and people came to me and said, would you consider running? I had no desire to run at all, but I put my name in the hat. I knocked on every door, and I won a historic election in my city and was the first African American elected in the city as well as in our county at the time. But in Alabama, I've served in a number of roles. It involved serving as a executive committee chair for the Democratic Party in Lauderdale County. I was twice elected there to do that role. I was twice on the level of the state Democratic Executive Committee and was the nominee for U.S. House of Representatives in 16, Lieutenant Governor in 18, and United States Senator in 2022. So I thought I was done, but people came along and said, would you consider running? Not many people, obviously, in Alabama on the Democratic ticket win general elections. Matter of fact, it's been decades since one has won a regular election. So people think it's an uphill battle. Why do it? I say, why not do it? There are a lot of challenges we have in Alabama. So my why is running so every Alabamian can have a fair shot. At one time, I would say a shot at the American dream, but most people don't know what that is because of the nightmares that they're facing, and perhaps we'll get into later on. But jobs not being available, healthcare not being accessible, and communities that aren't stabilized is a scary thought for many people. So that's what I've been doing, especially over the last year, traveling the state, listening to people, and trying to offer solutions.
Yeah, okay, so how do you think your background has uniquely prepared you for this role you're about to take on?
I'm a public servant. I'm a person who believes in being also a servant leader. I've served in elected office. I've served as elected to serve over churches and ministries. I've served in the community as a person who's been on a hospital board. I have a background that has led to my doctorates leading into organizational management, leadership, and even serving in psychology from a Christian worldview. But it all pulls together that I believe I can serve the state of Alabama, particularly with putting jobs there where they need to be. Workforce development is what we call it. I've taught business, so I know how to do that. I know from a healthcare perspective how I can help move us in a direction so that we have less uninsured individuals in Alabama. And purely from a community standpoint, I've worked communities, lived in communities, and know what we need to make Alabama better.
Amazing, yeah.
So if you were to be elected, what would be your top 3 measurable goals as governor of Alabama?
Well, my top goal is making sure that we have, as I said earlier, workforce development and expanding economy. But what does that really mean at the bottom line? Well, it really means at the end of the day, I want household income improved, or I want it to come up. Right now, we're looking at a household income of about $60,000 per family. I would like it to be increased by 10 to 15% over 4 years. And so I would love household income to rise up to the level between 66 and 69,000 by the time that term is up in office for me. Secondly, I would love to see, from a healthcare perspective, less uninsured people. Right now, the uninsured rate for people in Alabama is somewhere between 9 and 10%. Nationally, it's around 6, so we want to get it to that level. We're looking at a state right now where there are almost 300,000 people who would benefit from an expansion of Medicaid. We have a lot of hospitals that are closing, almost 25, some estimate more. And so we have a lot of people who don't have access to health care. So bringing that uninsured rate down to 6% or below would be phenomenal. Lastly, as it relates to to communities. We want to make sure that we have, beyond that workforce development, other measurable numbers that relate to workforce participation. So at the end of the day, you want communities where people are working. You want everybody to have the economy where they can shop, eat, buy, but you want workforce participation ultimately to move from around 58% where we are right now to somewhere around, I would love to see at least move us into the 60th percentile. And I'm sure we're going to do that with some of the plans that I have for Alabama.
Okay, so along with those plans, what are some specific economic policies that you can propose to lower the cost of living for average Alabamians?
Affordability is a key word that you hear a lot in all over the United States. Really, it's affordable housing, making sure it's affordable to everyone. I'm speaking of rent. I'm speaking of buying homes right now. There are ways that we can bring that care to the owner's market in such a way that people can qualify easier. They can find that there are not as many things that trip them up from a perspective of the application process, the hidden cost, as we call it. We can make sure that people who are renting feel like there is inventory out there that is affordable. I'm talking to people right now who saw property around $500 to $600 a few years ago, now at $1,500 in some cases. That is just unbelievable. If you had $100 2 years ago and compared it to where we are today, it's only worth about $80. So I could talk about terms like consumer price index and the cost of goods and services relative to where we are versus then. But making it very simple, you can have more money but afford less. And so we have to work to make sure housing is affordable. Healthcare is affordable. I've already mentioned that, and I will touch more on that if I can in a moment. But also, we have to make sure beyond housing and healthcare, childcare is available. A lot of people struggle with jobs that don't have childcare services on site. And so we want to give incentives to businesses that are willing to set up daycares or childcare there. Alabama has uniquely the number one pre-K program in the nation. Sadly, only about 40% of our kids enjoy that pre-K. So if they start off on the wrong footing, they tend to carry that with them all the way through. And that's how we wind up being at the bottom as it relates to education, reading, and math.
So you talk a lot about workers and workforce development, getting people back into working. So what do you see as the biggest threat facing workers today in Alabama?
Well, skill set is an issue. When you have jobs coming in with more highly technological needs, they want workers who are going to have the ability to perhaps work with programmable logic device or work with some type of computer interface. They may need to understand AI. It's just a whole new level of skills that is required. So it's not just about saying we want to just send people back to school, go to get another degree, but you have to have workforce readjustment. There are people out there who've been working for decades, but they have to embrace a brand new world where, traditionally you might sit down behind a computer, you might work a week, and you might have a program or a spreadsheet that you may produce. And now you can just go to Claude, go to ChatGPT, give it a few prompts, and you have a result in 2 seconds. That makes it very hard to feel like you are competitive against something you can't see. So again, making sure skill sets are there is important. I mentioned the child care being available, child care services being there. That's definitely needed. Making sure people feel that there are opportunities for advancement. Regrettably, in Alabama and even in the nation, we see where there is not equality of pay between genders. So you may find where a female makes 77 cents to every dollar her male counterpart works. That's not good. You find that there's also a very high number of African American women who lost their jobs in the last quarter of the last year, which took a tremendous toll on our economy and a big dent on GDP. And it's not African American women alone, white women, it goes on and on. So we have to work to make sure there's fairness in the workplace. We're also seeing where we use terms like OSHA, the Occupational Safety and Health Administration. We have to make sure that job sites are secure. Injuries are what cause people not to show up to work from time to time. So it's a number of things, all from a socio-economic perspective that are kicking in that's causing the workforce to be strained right now.
Good answer. Okay, Alabama is ranked on in the bottom tier nationwide about education. What do you think's the root cause of that?
The amount of money per student that we are seeing right now is not equitable to make our students competitive against other states. Narrowing down or zooming in on the problem, honing in on it, I think it's just dollars per pupil, but also the fact that we don't see educational equity across zip codes. So the way I want to address that is the educational lottery. And I know we're in a conservative state where people say, well, casinos and gambling is not going to be accepted. I agree and I get that. But an educational lottery would bring anywhere from $800 million to $1 billion to our state.
Wow.
May, it's the truth. Now imagine with $1 billion of revenue, what we could do. We could make sure pre-K is fully funded for all 100% of those students who are 0 to the age of 5 before they go to kindergarten. We could make sure there's educational equity. So kids that are in the Black Belt also have schools like the schools in Mountain Brook or Hoover, right where I'm from or where you're from or where others are from, making sure that people who are in LA, Laura, Alabama, do as well as the people in the North Alabama. So it's important that we see that educational equity. $1 billion could not just ensure that kids do well from pre-K all the way through high school and even fund college for everyone at the undergraduate level, but it will allow us to stop seeing Alabamians pay for the education of people in Mississippi, Georgia, Tennessee, and Florida. That's what we're doing right now. If you don't like gambling, I get it. I understand. I've never gambled in my life. But right now, Alabamians drive across state lines and they give money away, so to speak, with the hopes that they're going to get money back, right? So they're taking a chance. About $1 billion, though, would allow us also to be not only competitive from the student perspective, but we could actually pay teachers what they're worth. Right now, for a person coming out of Florida into Alabama, they're going to take about a $50,000 pay cut. That is almost equivalent to what I said is the household income right now for Alabamians. So why would a person want to move here to teach? Teaching is also challenging because if a person has a lot of student debt and they need to pay it off, but they have a very low pay scale, how are they going to ever catch up whenever we have grocery taxes, whenever the cost of living is, of course, rising? And all things I mentioned earlier, it's just harder to find jobs for perhaps a spouse. Healthcare costs are rising in their communities. The houses aren't affordable. A lot of issues hitting at the same time. That's why I said social economic issues hitting them. So I wrap it up by just saying, imagine if we could have what we call a public service loan forgiveness program. And for every teacher who's willing to teach in Alabama, we forgive them of their student loan debts by $15,000 a year. We then have what we call brain gain instead of brain drain, Olivia. So we want to make sure we keep our teachers here rather than feeling they need to leave and go to another state.
Interesting. I like that.
So you touched on this with like the lottery idea for lowering the cost of higher education for Alabama students. But do you have any other ideas on how we can combat that and get more Alabama students to trade schools or universities or anything like that?
Absolutely. Once again, I want to emphasize just for the segment, the educational lottery alone brings in $800 million to $1 billion to students. That is an amazing number. If you look at the big chunks of our budget and our revenues, most of it is the educational trust fund. The other half is the general fund, making it very simple. So a lot of money is there for education, but some people have felt like the educational trust fund has been robbed whenever we have a crisis. So we call it the educational slush fund. Should not be that way. Funds that come in from the lottery should be dedicated to the trust fund, the educational trust fund, and nothing else. So just making sure that money is reserved for them changes everything for Alabama. But organized labor does a phenomenal job with blue collar apprenticeship programs. So if a person says, hey, I want to perhaps leave high school and go into the blue collar work, they really can become six-figure earners in year number one. I don't know if people know that or not. Some blue collar workers are actually millionaires. They actually retire with great defined pensions and benefits, whereas others don't have that luxury. Another thing that we can do is work on the dual enrollment program. One of my young people, my middle daughter, did it, and she was able to, with that high GPA she had, actually have college credits that she was earning, and it knocked actually 1 to 2 years off of her academic journey. So imagine going to school. Imagine if the lottery were not there yet, right? Because it'll take over a year for the lottery to kick in. It'll take a three-fifths of a vote from the legislature, because right now lotteries are forbidden in Alabama according to the Constitution. It would then take a statewide referendum. So you're talking about a 1 year trajectory on that. But imagine now, day one, whenever I'm in office in 2027, where I can offer the ability for kids or students, young people, to do well at dual enrollment, to cut off 1 to 2 years off their educational journey. That would be phenomenal. So there are a lot of ways we could attack it, but the main thing is an educational lottery.
Great.
Education is really the key in my mind to a lot of Alabama's problems being resolved. If we just focused on education at a greater level, it would do our state a phenomenal service. Right now, without me trying to bash any particular opponent, on the other side of the aisle, the person who's like to become the Republican nominee is actually suggesting that $1.3 billion go to building more high-tech prisons. Instead of that $1.3 billion going to prisons, I argue it should go towards the classrooms.
Mm-hmm. Yeah.
Cages should come behind the classrooms.
Yeah, well, this kind of leads into the next question. Across the media, Alabama prisons have received a lot of backlash.
Mm-hmm.
What do you think about that, and how would you like to describe that current situation?
One of the things I'm going to do day one is make sure that I have a complete overhaul of the Alabama Department of Corrections. I would agree that there is a serious problem there. We're looking at overcrowding. We're looking at a safety issue for officers. When you have a high student faculty rate in the classroom, it makes it harder for a teacher to teach, right? Or it makes it perhaps more challenging to maintain control. Whenever you have an officer who is trying to watch more incarcerated citizens, she or he has a position where their safety could be jeopardized, or even the inmates or incarcerated citizens could not feel safe because they don't have someone who's always there with them if they need them. Furthermore, we have a high level of overcrowding in our prisons that are dilapidated, and we have people who are actually dying in our prisons. We need to stabilize our prisons. We need to make sure they're safer places. I know there's some people we'd argue should be in prison, but there are a lot of people who should not. And so I have a plan, even though PTSD is normally associated with the psychological side, post-traumatic stress disorder.
Mm-hmm.
I talk about PTSD from a perspective of a solution to Alabama's problems by saying, number one, if you're 55 or over and you don't have a violent crime, you should be considered for a presumptive parole. That means, taking us a little further, we should have also a cap on technical issues. A lot of people who don't need to be in prison are there because they have technical issues that are stacking up on them. And by technical, I mean they haven't done anything that's a violent crime. You could even argue it's nonviolent, but it's perhaps something they missed. They missed an appointment. They missed paying a bill. I'm making it very simple, but these are technical issues, right? So we need to put a cap on the way people can stack technical issues. That's the P and the T. The S relates to within 60 days of you being eligible for parole, Olivia May, you have to be in a place where people have to not only have a hearing, but also within 7 days write you back and tell you why you were denied if you were, or have a second look. So that's the S. Then the D is where I want everyone made to be data driven. Look at a dashboard and see how many inmates are in a particular facility, what wraparound services are there, mental health or educational training. We have people in prisons right now that a judge may order that they need treatment, but the treatment might not be available. So when you have a program that's supposedly ordered and you're in a place where you can't get it, your sentence is being prolonged. And I just mentioned earlier, Alabama right now is fine placing $1.3 billion on prisons. We are becoming slowly the incarceration capital of the world. And unfortunately, the number of people in prison, when you look at the numbers, it's disproportionately people of color who are there, even though African Americans only make up 27% of the population. You look at the prison population and we're way over 70, way over 80. So you have to ask yourself, what's really going on here? There's something systematic that has to change. That's why I say we need an overhaul. Victims also need protection. So we need to make sure that those who've suffered from someone who committed a crime against them, that they verbally and in writing know what's going on with the person that may have been convicted or is serving time, especially when they're being paroled. So my plan rolls out day 1, day 30, 60, 90, 180, and even 365, how we're going to move towards this great reform that's going to move Alabama in the right direction. But within 3 years of my program being in place, we're going to save the state $300 million. So all of my programs alone represent about $3.3 billion that I'm going to bring to the state of Alabama by 2028.
Going back to healthcare, Alabama is known to have some of the worst healthcare across the country. And you mentioned the rural hospitals closing. We want to know, how do you plan to support healthcare across Alabama?
Great question. We will really help healthcare out in Alabama by expanding Medicaid. That is the simple solution. And the simple solution is if we invested $22.8 million. If you said, Will, where is $22.8 million coming from and why that number? It costs about $228 million to expand Medicaid in Alabama to move us forward. But Obamacare or the Affordable Care Act would pay 90% of that. Even if it didn't, and we were between the $22.8 million and the $228 million, we have a return of $394 million. Now, that's a great return on an investment, right? You invest $22, you get $394. That's cool. But it's bigger than that, 22.8 million, 394 million. Not only that, we get $2 billion of new revenue every year. 200,000 people have new jobs. 282,696 Alabamians now have Medicaid who need it today. And the list goes on and on. Most importantly, we stop the hospital closures. And so that's how we can address the healthcare system in Alabama.
And to kind of close off this budgeting thing, as governor, you'll be in charge of the Alabama budget. Where do you believe Alabama should be focusing its resources to create the biggest impact?
Education is definitely where we want to be. And it's obvious that the Educational Trust Fund is a large portion of the revenues, where the revenues come in, and of course expenditures where we're spending. I think that shows education being the primary focus can shift us where we need to be in the next direction. Starting off well at pre-K levels, even high school and college will help us. So we need to invest in colleges, universities, invest in the trades, invest in making sure that our schools are offering the programs that are needed. And I've already talked about making sure the teachers are paid equivalently to, if not better than other states. These are things that will help move us forward. The reality is Alabama had great revenue streams, but those revenue streams are drying up. And so now in 2026, 27, we're looking at revenues falling in such a way that already programs are being impacted. I'll give you an example. When we had HB 445, which was a hemp ban that kicked in, it actually took $1 million of revenue from our state. I've never done hemp, never chewed a gummy, never smoked a flower, never done anything like that. But I listened to 1,000 business owners say, all of a sudden, the business idea that I had, the business that I invested in, it was crushed because they had to sell all of their product. And again, the $1 million of revenue that they would have brought in is gone. Imagine if something's legal today, and then with one stroke of a pen, it's illegal tomorrow. It may not be hemp for you. It may be something else. It may be chocolate chip cookies. It may be milk. I don't know. It could be something. It better not be. Those are fighting words, right?
Yeah.
But that's the way they feel. Imagine your passion, right, for Chips Ahoy or Soft Batch, right? All of a sudden, somebody says you can't have it anymore. You can't sell it anymore. You can't package them. That's what happened in Alabama. And so we have to be creative. And that's why I mentioned the $3.3 billion. I'm not coming in to give anybody anything. Alabama is a welfare state. For every $1 we give to the federal government, we're asking for 4 back. When you look at some of the educational, I'll just say, proposals I've made today, just an investment of $1 can bring about anywhere from $4 to $9 of return. So this is why it's important to have bold ideas, people that want to come in and infuse money in the right places rather than the wrong places.
If not for my own information and understanding,
Yes.
you mentioned with the Medicaid as well,
Mm-hmm.
this return on investment, 28 to 330.
You got it. You got it.
Something.
Invest 22.8 million.
22.8.
You get 394 back.
390.
$2 billion worth of revenue. 200,000 jobs. You stop 25 hospitals from closing. You get 282,696 people health care that they don't have today. That's bringing down that uninsured rate that I was talking about earlier that I said was very high, that we want to get down to under 6% at the national level. That's how we do it. That's how we tackle it. That also provides health care for families in such a way that you have less infant mortalities or deaths of children. You have less deaths of mothers, that's maternal mortalities. And of course, you see a lot of people who are in rural areas right now of Alabama that don't have any hospitals at all. No ambulances. I was in a place last night. They have 4 ambulances in the county. Only 2 are operational. Now imagine being in Pickens County where they have in Aliceville 1 ambulance. And imagine if you were cutting the grass or brother, dad, sisters cutting the grass, a blade comes up the lawnmower, hits them in the foot, or they run over their foot by accident. It would take an hour for an ambulance to get there if it's not transporting someone to Tuscaloosa for dialysis, and an hour to get you back. Imagine, sadly, atrial fibrillation, stroke, cardiac arrest. Any of those things happen. Seconds count. You're not talking about a helicopter coming your way. The best thing that you can get is an ambulance. You don't get it. There's certain counties right now where people told me their car rolled over. I saw a car in a ditch today, but cars have rolled over into ditches. And when they needed an ambulance, there was not one. The fire truck arrived and the fire team asked, would you like to phone a friend to get you to the nearest hospital that's 1 hour away? So May and Olivia, ask yourself, in 2026, when we don't mind spending billions in wars, why do we still have counties in Alabama that are struggling? Now, if we talk about health care, let's talk about some root cause problems. In Chambers County, the water is black. Not clear, black. In Lowndes County, just like we might go and wash our hands, the water goes down the sink, down into the septic tank or the city sewer. In Lowndes County, they don't have septic tanks. They don't tap into sewer. Their water goes to their backyard. So we have in Alabama 25,000 people suffering from septic crisis issues, sewage issues. That means environmentally, the water's contaminated. The ground has things in it that we don't need to talk about. The air quality is poor, and it goes on and on. So if you're treating your environment so poorly and you're drinking water that's coming from a well, from a ground, you're drinking water that's coming from perhaps like Mobile where they had a mercaptan spill, a chemical spill, you can see why there's some concern. So this is why I'm passionate about environmental protection, making sure I tie my environmental policy into my economic policy. When you have all this erosion from new buildings that are going up and nobody's thinking about the green space, where's that water going? It washes away soil. We're thinking about putting up perhaps windmills or solar panels. Wonderful, but why are we putting them up on fertile ground that we could use for agriculture? Alabama is probably the most biodiverse state in the whole union, in the nation. And so we need to take care of her.
If you had the attention of every Alabama lawmaker for 1 minute, what would you tell them that needs to change right now?
I think unity is important. I would say that we need to be a hope state instead of a hate state. I think that every Alabamian should have a shot made and an opportunity. And I think when you're elected, I think politicians really do get elected believing they're going to do great things and they want to help all people. And then I think what ends up happening is they get to Montgomery, they get to Washington or whatever the state capital may be for their respective state, and they start to see it's all about dialing for dollars or making more money or special interests. And before we know it, someone else owns them. I think we have to be reminded that the people are actually the ones who are there. And so this is why I pass out these will bills. Would help if I had it so you could see it or the camera could see it, right? But there we go. But this is a Will Bill, excuse my face being on it, but drwillboy.com where you can go to learn more about the campaign. But we want to let people know that we didn't buy this by influence. We shared an idea, and participation is basically what's on here. Participation is not a purchase. Everybody has one voice. Everyone can take part and be a part of the process. And that's what I want legislators to be reminded of, that we can work together. Special interests don't need to own us. We can serve the people and be reminded that we represent them.
So this kind of leads into this question.
Yes, ma'am.
Why would a lifelong Republican vote for you?
Olivia, I think a lifelong Republican would say, and they already are, we may not agree on the same ideas, policies, but at the end of the day, they see that I really care about all Alabamians. I always try to start from the issue of what we agree on and then slowly get into what we disagree on. And even there, I try to present it in such a way that we come about solutions together.
Last question.
Yes, ma'am.
This is kind of a challenge question, too.
Oh.
Yes.
Do I need to leave right now?
Don't get nervous. You got this. You got this. I believe.
All right.
In one sentence, why should people vote for you?
Because I will give every Alabamian a fair shot.
Ooh.
Great.
Short and sweet. I love it.
That was amazing.
Well, thank you. I enjoy being with both of you, Olivia May. Thank you. Appreciate you.
Thank you. With you too.
We really enjoyed it.
I wish you both much success in all you do.
Thank you.
As future governors of Alabama as well.
Yay, we'll carry on the legacy.
All right.
Yes, that was great. Thank you so much.
Oh, thank you.
Yeah. Okay, and y'all don't forget to vote. May 19th is the primaries, and we'll see you later.
Bye.